Hi, good morning, Jones. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
Your preparation time is over. You can now start your role play.
Good morning. I'm Nurse Milan Hallway. May I confirm your full name, please?
Good morning. I'm Mihiraa.
Thank you, Mihiraa. Could you please confirm the reason for your visit today?
I was recently diagnosed with diverticulosis, and my GP said I should see you for some education on how to manage it long term. To be honest, I'm a bit worried because I don't fully understand what it means.
I can understand why that would feel unsettling, Mihiraa. Hearing a new diagnosis can naturally bring some worry with it. My role today is to explain the condition clearly, talk through how it can be managed, and answer any concerns you have, so you feel more informed and supported. Let us start with what diverticulosis actually is. This condition means that small pouches, called diverticula, have formed in the wall of your colon, which is the lower part of your large bowel. These pouches develop where the colon wall may be a little weaker, often due to increased pressure inside the bowel over time. The important thing to understand is that diverticulosis itself is usually asymptomatic, which means most people have no symptoms at all and may never know they have it unless it is found during a test for another reason. It is a very common finding, especially as people get older. Would you like to share what has been worrying you most since you were told about the diagnosis?
Yes, I keep thinking, what if these pouches get infected? I read something online about diverticulitis, and now I am scared that one day I'll develop a serious infection and maybe even need surgery. I also worry because I don't know if I should be eating differently or avoiding foods.
Those are very real fears, Mihiraa, and I want to address them directly because what you are describing is a common worry. You mentioned infection and surgery, so let me reassure you. Diverticulitis, which is when the pouches become inflamed or infected, does not happen to everybody with diverticulosis. In fact, most people live their entire lives without ever developing diverticulitis. The focus of long-term management is prevention, and there is a great deal you can do through diet and lifestyle to keep your bowel healthy and reduce the risk of future problems. Surgery is not the path for everyone. It is only considered in cases of repeated severe diverticulitis or complications, and that is not where you are now. Your concern about what to eat is actually very helpful because diet is one of the most powerful tools you have. So please take a moment to let that sink in. You are not powerless here, and diverticulitis is often preventable. Now, I will walk you through the dietary guidelines for diverticulosis. The main principle is a high-fiber diet. Mihiraa, fiber makes your stool softer and bulkier, which helps it pass more easily, and that prevents the high pressure inside your colon that contributes to pouch formation. You want to include plenty of fruits, vegetables, whole grains such as oats and brown rice, legumes like beans and lentils, and nuts and seeds. Alongside that, you must stay well hydrated, aiming for about 6 to 8 glasses of water a day, because fiber works best when it absorbs water. I also recommend eating regular, balanced meals rather than skipping meals or having one very large meal, which can overload the bowel at one time. Before we go further, I need to ask, do you experience any allergies, for example, to any medications or specific food triggers that you have noticed?
I don't have any medication or food allergies, but why is fiber such a big deal for this condition?
That is an excellent question. The importance of fiber management in diverticulosis cannot be overstated. First, fiber prevents constipation, which is the straining and hard stool that raises pressure inside the colon and encourages pouch formation. Second, by keeping the stool soft and easy to move, fiber avoids that harmful pressure that can stress the colon wall. Third, it improves bowel regularity, so waste moves along at a steady pace, reducing the time the colon is exposed to potential irritants. In simple terms, your goal is a calm, low-pressure environment inside the bowel, and fiber is the key to achieving that day after day. Diet is central, but there are additional lifestyle modifications that make a real difference. Mihiraa, regular exercise, such as brisk walking for around 30 minutes most days, helps stimulate natural bowel contractions and reduces pressure inside the colon. Maintaining a healthy weight is also protective, as excess abdominal weight can increase pressure on the bowel. If you find it hard to get enough fiber through food alone, a fiber supplement can be considered after discussion with your GP or dietitian, but it must always be taken with plenty of water. These steps together create a strong foundation for long-term bowel health.
I will try my best with all of that. What happens next from a medical point of view?
For ongoing care, I would like to schedule a follow-up appointment in about 3 months. Mihiraa, that visit will let us check how you are progressing with the dietary and lifestyle changes, review your bowel regularity and any symptoms, and decide if any tests are needed in the future. This is a long-term partnership, and we want to make sure you feel supported. Before we conclude, do you have any other questions or concerns?
No, I think I feel much clearer now. The 3-month check sounds good. I do not have any further questions at the moment.
I am pleased to hear you feel clearer, Mihiraa. Let me briefly summarize our discussion so you leave with a clear picture. Diverticulosis means small pressure-related pouches in the colon wall, usually asymptomatic, and it is a very common finding. Your concerns about infection and surgery are understandable, but diverticulitis is often preventable, and serious progression is not inevitable. Your main management tools are a high-fiber diet with good hydration and regular meals, avoiding personal trigger foods, and noticing how your body responds to spicy or gas-forming foods. The aim of fiber is to prevent constipation, lower colon pressure, and keep bowel movements regular. In terms of lifestyle, regular exercise, maintaining a healthy weight, and possibly a fiber supplement all add protection. We will meet again in 3 months to review your progress. I will now book that appointment for you, and you are welcome to call if anything comes up in the meantime. Thank you for coming in, Mihiraa.